As we mentioned earlier in the show, actress Angelina Jolie just revealed she had a preventative double mastectomy.
And here to tell us what that entails and how it can help save your life is Dr. Robert Plummer, a board-certified general surgeon. Thanks for being here, doctor.
It's a pleasure to be here with you.
Now, we have to start off by asking this question because although Angelina Jolie admitted she does not have breast cancer, she found it important to have this surgery because she discovered that she had a gene mutation called BRCA1. Now, what exactly is that, and why is it important for people to know if they have that gene mutation also?
Well, the BRCA1 and BRCA2 genes are those genes that are associated with patients who have a family history that's very, very high in breast cancer and ovarian cancer. And those patients are really at a risk of close to 80% of those members in that family developing those cancers, specifically the breast cancer component.
Now, how common is the BRCA1 gene mutation?
Well, looking at all breast cancers and the causes, there are a number of other genes besides the BRCA1 and 2. Lumping them all together, you'd say about 5% to 10% of cancers, breast cancers, are caused by genetic mutations.
Wow, and that makes you 87 or in the 80% higher risk of breast cancer?
Those patients who have that gene, 80% of them, if followed over their lifetime, will develop breast cancer. The normal incidence of breast cancer in the general population is 1 in 8 women over their lifetime will develop breast cancer.
Well, I know that
That's
Angelina...
a stunning number.
Over their lifetime, correct.
And I know her mother, she had and actually passed away to ovarian cancer. So is that a good determinant to know if someone should get tested, whether other family members have had it?
Yes, actually, the recommendation right now by the American Cancer Society is that if you have a first-degree relative, meaning your mother, or you have a sister or an aunt on your mother's side that has breast cancer, that you should consider getting tested, especially if more than one first-degree relative, more than one sister, a mother and an aunt, develop breast cancer. It's something to consider getting tested.
Now, is there a group of people that's more susceptible to this gene mutation than others?
This specific gene, the BRCA1 and 2, have been shown to have a slightly higher incidence in Ashkenazi Jewish women.
Okay.
But there are other genes that are associated with breast cancer as well, which occur in less frequency than the BRCA1 and 2. But it can occur in any age, in any ethnic group, any racial group.
And, you know, a lot of people have commented on just how young Angelina Jolie is, but you say that this is not reserved for older women. It can affect a woman of any age, really. Actually,
Women with this gene develop breast cancer at an earlier age. So, in fact, patients who have been tested, and in general, if you have a first-degree relative that has breast cancer, you should start getting screened and tested earlier, meaning, you know, even in your mid-20s, 30s. The current recommendation by the American Cancer Society is that the typical woman should get a breast mammogram, her first screening mammogram, at about the age of 40. That's if you're basically in the general population. Typically, we find that there's a higher incidence of breast cancer the older you get beyond the age of 50. Some of the recommendations have moved towards screening at the age of 50. But in fact, there are women who are at higher risk at developing cancer at an earlier age. Specifically, African American women have been shown to develop cancer, breast cancer specifically, at a younger age, in their 40s, and even younger.
Why is that?
Those studies really haven't shown specifically why black women are at a higher incidence of developing breast cancer. But we do know that that's a factor. And if your relative has developed breast cancer, you should be screened earlier.
So after your first screening, how often after that should you be screened? Several times a year, every month?
No, typically after your first breast mammogram screening, you should be tested annually, once a year, with a mammogram. And early detection really is the key to breast cancer. It can be cured, catching it early.
Wow.
So other celebrities that have had a similar procedure include Christina Applegate, Wanda Sykes. How important is it for celebrities to be open about their challenges?
I think it's very important. What happens is your celebrities, of course, because of their exposure to the media and their high profile, that shows, number one, it disseminates information. So people are going to be more aware of breast cancer. They're going to be more aware of breast cancer screening and the risks. Of course, now with this BRCA gene, it's on everyone's mind.
Right.
To be tested, to be screened, and to consider a mastectomy as a possibility if you have that gene.
And I think it's important for people to understand that it's not just a women's disease, that a lot of men, I know some celebrities include Richard Roundtree from Shaft, Montel Williams, the talk show host, even the guy from the Kiss band, Peter Criss, he's also had it. So what percentage of men can or have been found to have breast cancer, and how concerned should they be about being tested for this gene mutation?
Well, the incidence of breast cancer in men is about 1%. So if you have 100 breast cancers patients, one of those will be a man. So it's relatively rare in men. It's not something that you would consider doing genetic screening in a man unless he had some family history that showed that there was some high prevalence in his family.
You talked to us about the importance of early detection. So what are some other things that people should be doing earlier on so they don't have to be in this similar position as Angelina Jolie?
Well, for the recommendation for the general population is to do breast self-examination, which is that women should learn how to examine their breasts, typically in a shower while they're showering about a week or two after their menstruation. They should also get regular breast exams by their gynecologist or their primary care physician, and that they should at least consider getting their first mammogram at the age of 40, and or even earlier if they have a first-degree relative that has breast cancer. So if your mother had breast cancer, I think you'd want to start looking at getting screened even in your 30s or late 20s.
Around 35?
Yes.
25 even?
Well, even in the late 20s, if you're an
20s.
African-American woman, I think, and you have a mother or a sister that developed breast cancer, you'd want to make sure that you're getting screened early, at least with regards to self-examination and your physician examining you.
Well, we always hear this. We say people know this, that they should get tested. Other women I've spoken to say, yeah, I know, I just haven't got around to it. What advice can you give to them to encourage them to get tested, stop putting it off, even, if it's every day checking yourself in the shower? What is the advice you can give to people to show them the urgency behind getting tested?
The key thing, the take-home message for women is, number one, breast cancer is curable and preventable in the circumstances of Angelina Jolie and patients that have that gene. That's the first take-home message. It's a curable disease. Secondly, the treatment early on, if cancer is very small, early phase, doesn't mean that you need to have a mastectomy. The breast can be conserved. You can remove that tumor before it becomes a major, large tumor and conserve your breast, and just have the lumpectomy and conservative management and maintain your breast and form.
Do you think there'll be an Angelina Jolie effect? I mean, she's done wonders for adoption. Do you think you'll see something similar for the world of breast cancer treatment?
Well, someone in her situation with such a high-profile exposure, I think this will bring more awareness to, number one, breast cancer, two, the BRCA gene, and the fact that women who consider that their families are at high risk will consider getting the test, number one, and two, consider the mastectomy. Because the prophylactic mastectomy that she underwent, I'm sure, was combined with plastic reconstruction. And nowadays, the plastic surgeons do such a good job that it would be very hard to tell that she had a mastectomy, I'm sure. This can be done simultaneously with the mastectomy, doing implants, doing reconstruction. So remarkable work has been done on the reconstructive efforts.
Very good information. Thank you, doctor, for coming in and sharing this with us. And I hope people at home were listening and taking heed of your warnings.
It's a pleasure to be here.
Thank you.
Thank you.
You're watching Arise Entertainment 360.